Welcome to ARAA Home Care Employee Training.
Our home health is designed to meet the unique needs of patients and families. Our motto, "We treat family as a whole," services and tailors to assist our clients and family members to achieve optimal level of care and independence. Our care is based on putting our clients and family members first, respecting the dignity of each member. Our services are intended to be provided in the least restrictive setting, allowing our clients to remain at home and independent.
You are responsible for maintaining the requirements for ongoing employment, including keeping your certifications and licensing up to date, along with your annual TB screening. ARAA offers paid required onboarding and annual training for all employees through Care Academy. Employees of ARAA Home Care LLC shall not disclose or knowingly permit the disclosure of any information in a client record except to the appropriate provider staff, the client or responsible party, the client's physician or other healthcare provider, the State Department, or an individual who is authorized in writing or by subpoena. For the release of information, the client, parent, or guardian must authorize the release of information by signing the appropriate form. It is important that you are aware of our patients' rights and become familiar with our policies. You will be responsible for honoring the rights of the patient to accept or refuse services at any time. They have the right to be involved in their care plan and make any changes. Always maintain confidentiality and treat their home and family with respect. Our companion and patient care assistants, also referred to as PCAs, provide many services to our patients, such as serving meals, assisting with appointments, and light housekeeping. It is important to understand that the PCA cannot perform the following services: nail cutting, wound care, range of motion exercises, bowel or bladder care, enemas, suppositories, or full load ambulation. Our registered nurses and licensed practical nurses provide a variety of skilled services to our clients. They are also responsible for teaching, training, and assessing our caregivers in the field and performing supervisory visits with clients. Our certified nursing assistants, also referred to as CNAs, aid clients with services such as hygiene care, toileting, ambulation, medication reminders, monitoring vital signs, and home care management. CNAs may not administer medication unless they are also certified as a medication technician. All PCAs and CNAs will meet with our staff RNs regularly to assess skills and interactions with clients. These visits may occur within 7 days of servicing a new client in increments of 30, 60, and 90 days. This is a great time to communicate any questions or concerns you may have about providing care to your client.
It is very important for ARAA personnel and clients to be prepared in the event of any type of emergency or natural disaster. We make every effort to continue to service our clients, but the safety of our staff is always a priority. It is important that you never make assumptions in any situation and always communicate with the main office and clients as specified in our disaster preparedness plan.
Each caregiver should have a clear understanding of their client's evacuation plan, how to assist them, and who to contact. The flow of our supervisory visits will begin immediately after the first date of contact with our client. The RN and administrative staff will visit the client to perform an assessment and get to know the client. Within 15 days of their care beginning, the RN will make another visit to the home to ensure they are satisfied with the level of care they are receiving and answer any questions. After 60 days of the client's initial assessment, the RN will return to assess the client's condition and make any necessary changes to the care plan. At 90 days, the RN will visit the home with the caregiver present and assess the skills and services being provided by the PCA or CNA. Each client is assigned a priority code which indicates the severity of need to service the client. Priority 1 is the highest level of attention, as these clients need to be seen daily and would be significantly impacted by a missed visit. Priority 2 patients should be seen within 48 hours of their missed visit, and Priority 3 patients should be seen within 72 hours of their missed visit. By now, you should have installed our Connect Team app on your personal device for communicating with staff, scheduling, and training.
This will cover what's in the client's home. You'll have your client binder, which will include the following. You'll have your client information, you'll have your physician contact information, referral information, service care plan, progress notes, service delivery form, monthly schedule, and a discharge note. Behind each tab, again, identification and the map to your client's home. Tab 2, physician contact information. Tab 3, referral information, which would include the diagnosis for your client. Tab 4 is your service plan, which will include the goals and objectives for your client. Tab 5 and Tab 6 is your progress notes and your service delivery form, to be used only if you're in a rural area or if you do not have internet service at your client's location. Tab 7 will have your monthly schedule, and Tab 8 is your discharge note. If your client is discharged, you will return the binder and the bin to the office. Inside of your bin will include your gloves, your paper towel, hand sanitizer, and mask. If your supplies are running low, please contact the office and we'll replenish all of your supplies as needed. Thank you.
Thank you.
Client notes are required for every shift. These can be accessed in your assets, then click Workflows, then click Client Notes. These must be completed and signed for every shift before you clock out and are necessary for accurately calculating your time in the client's home. Client notes must include all activities and services that were provided during your visit with the client. For some clients, a minimum of 3 ADLs must be performed and documented in your client notes and include bathing, dressing, grooming, feeding, transferring, toileting, or ambulation. Always be sure to record and document accurately. When recording information on your client, be sure to follow these basic rules. Thoroughly describe what is happening with the client, any actions you took, and the client's response to that action and/or any change in the client's condition. When electronic devices are not available, written entries should always be legible in blue or black ink and should be recorded as close to the time of service as possible. Your entries should be complete, consistent, and accurate with only approved medical terminology and facts about each occurrence. Documentation should be aligned with the client's care plan and include all details regarding the date, time, tasks, and client's condition. Most documentation will require a signature from you, the client, and/or your supervisor. Incident reports must be filled out within 24 hours of an incident or complaint. This can be accessed in your assets, then workflows, then click the incident complaint form. Always call the office to report verbally as soon as you are able. Here are some handy tips for improved hygiene. Contaminated surface or objects should not be touched after performing hand hygiene. Avoid touching your face, especially your eyes and nose. Fingernails should be kept short, no longer than 1/4 inch. Nail polish may be worn but should be removed when chipped. Do not top up a partially used hand hygiene product dispenser. If reusable dispensers are used, they must be emptied, washed, and dried prior to being refilled. Hand lotion bottles must not be reused. Include frequently missed areas when performing hand hygiene, such as thumbs, palms, web spaces, under nails, and the backs of fingers and hands. Use supplied lotions that are compatible with hand hygiene products and gloves to minimize skin irritation that can occur with frequent hand washing. Artificial nails, gel nails, or extended are not to be worn by staff who have direct patient contact. Wearing hand and wrist jewelry is not recommended. Always wear clear uniform identifiers and your name badge while at work. Start each shift in a clean uniform and change immediately if your uniform or clothes become visibly soiled or contaminated. Your uniform should fit properly and not be tight or baggy. Shoes should be appropriate to the work being performed and should be non-noise producing. Every employee is expected to be neat and clean in appearance and to practice good hygiene. Keep your fingernails short and clean. Your hair must be clean, well-groomed, and neat. Tie long hair back off the collar. Hats, bandanas, and headscarves are not permitted unless part of your religious attire. Excessive fragrances or smell of smoke is not permitted. The use of jewelry should not be excessive or pose a safety issue. No staff, subcontractor, or volunteer of ARAA Home Care LLC shall behave unethically while acting as its agent. It is unethical for an employee of ARAA Home Care to do any of the following. Do not use a client's car for personal reasons. Do not consume a client's food or beverage. Do not use a client's telephone for personal calls. Do not discuss political or religious beliefs or personal problems with a client. Do not accept gifts or financial gratuities from a client or their representative. Do not purchase any items for a client unless directed in the client's care plan. Do not smoke in a client's home. Do not sell gifts, food, or other items to or for a client. Do not bring other visitors, such as children, friends, relatives, or pets, into a client's home. Do not report for duty under the influence of alcoholic beverages or illegal substances. Do not sleep in a client's home. Do not lend money or other items to a client. Do not borrow money or other items from a client or from the client representative. Do not allow anyone providing a ride to linger outside of the client's home or near their premises before, during, or after your shift. Do not remain in a client's home after services have been rendered. ARAA will often recognize and reward caregivers for going above and beyond their expected duties or for excellent performance over a period of time. You can achieve this by showing up on time and staying for the full length of your shifts, giving adequate notice for time off, documenting your client notes thoroughly, accurately, and on time, reporting any concerns that you may have to the office, communicating professionally with other staff and clients, clearly communicating schedule conflicts or concerns as soon as they arise, demonstrating flexibility when needed, being dependable, and continually providing excellent care to your client.